Dr. Salari. How are you?
Don, I'm doing great. How are you doing
Good,
today?
good. Always a pleasure to talk with you and see you. And you're such a great spinal surgeon, and you have such a great reputation in town.
Oh
And
gosh.
all the clients that I send you absolutely love the treatment you give them, and they get excellent results.
I
So
appreciate you saying that. Thank you very much. You're very nice.
you're
Okay,
welcome.
okay.
I've got a client that I want to send over to you that's got a pretty severe cervical problem, and the pain runs down both arms
Mm-hmm.
into the thumb and index finger
Mm-hmm.
of each hand.
Mm-hmm.
And how would you treat that?
Sure. I would certainly want to see the patient and be able to ask the questions and take a history from them personally. I think it's very important to get that information from the patient themselves, have them describe kind of the symptoms that they're presenting with. Certainly knowing the mechanism of injury that they had would help as well, along with any imaging studies that they bring along with them. The way you're describing that patient to me, it seems as though there's at least some involvement of the neural elements or the nerves that come from the neck as they are linked to areas in the body, and the area that you're talking about in terms of the forearm, the thumb, and the index, that to me sounds like the C6 nerve root. And C6 nerve root would come from the C5, C6 area disc space. And so once we have a good history on the patient, and we've been able to at least get some further imaging from them, especially an MRI scan, for example. That would be a very good study to have on this patient in particular. We would be able to take a look and see where that pathology could certainly be coming from and where the pressure is on the nerve structure. If it's in the spinal canal itself, where the nerve could be sticking into the spinal canal, for example, or if it's the area where the nerve root's coming out of the spinal canal on the side, where again the nerve could be pressing up against that in some way. And so depending on where the pathology is, we could certainly ascertain that a little bit better based on some of the imaging studies. And then from there, we can still decide how we're going to proceed and how we're going to take care of that patient. I try to maximize conservative care when and where I can. And so for this patient, we could certainly still see if physical therapy would be an option. Otherwise, injections or any other form of medication treatments that we could offer them. If it becomes a surgical issue after we've exhausted other options, obviously, then we can talk to that patient about how to treat them with surgery. And in this case, it would most likely be, because it's somebody who has symptoms on both sides, something that is likely involving the disc that's between the bone structures, and we would access that disc through the front of the spine, basically come in, remove that disc from the front, and depending on whether they still have good motion to the cervical spine or they have a lot of arthritis and other issues associated, we can discuss with them the option of either a disc replacement or a fusion at that level.
And the fusion would be through the front of the neck?
That is correct. The fusion would still be through the front of the neck because we can gain best access to that level going in from the front of the spine. Still do it through a very small, relatively minimal incision in the front that leaves minimal scarring.
And when you do a fusion, would it be 2 or 3 levels depending on the problem or what?
So hopefully we can isolate it to a single level. If the pathology really only goes back to that single level, again, if it's a very clear pattern of pain and the imaging studies indicate where that herniation is, then we generally like to go after that single level if possible. But we would have to evaluate the levels above and below and see whether those would be another potential source of symptoms overall.
And I know you have a facility here at your office where they can stay overnight after they've had the procedure. Is that accurate?
Yes, sir. We have the availability to offer them surgery here through our surgical facility. And also, if there is the need for extended stay or overnight stay, we certainly have the capacity. We have one of very few centers here in the Valley where we can offer the patients an overnight.
All right. Thank you.
Thank you, sir.
Good to see you again.
Great to see you.